As you were just, I'm sure, notified, this webinar is being recorded, and I will share more on that momentarily. Alrighty, well, we are at 1 o'clock, and I know that a few more people will be joining us based upon registration, but in the interest of time, I'm going to go ahead and get started. The Virginia Governor's Conference on Aging webinar series is generously sponsored by Virginia Housing. I will be sharing helpful links in the chat momentarily to our website and to our YouTube page, where you can find previously recorded webinars in the series. A quick plug for the Governor's Conference. We are really thrilled to have just announced our dates for 2025. It will be May 19th through 20th. I will put the conference information link in the chat as well. And we will be asking for volunteers, for steering committee members to help put the conference on. So I'll mention more at the end, but I just wanted to quickly mention that before we get started. I'm going to hand it over to Carla Hesseltine, who will introduce the webinar and our speakers a little bit further, but thank you everyone for joining. I do want to mention that we really do encourage questions. Please submit your questions through the Q&A box as opposed to the chat box. That will just help us keep track of all inquiries. You can also use the raise hand feature to request to be unmuted during the more formal Q&A portion of the webinar. But keep your eyes peeled on the chat box for those links, and I will hand it over. So thank you so much for joining.
Thank you, Jillian. And thank you for everyone attending today. As the chair of the Commonwealth Council on Aging, I'd like to welcome everyone to the webinar, which is a partnership between DARS, the Virginia Association of Area Agencies on Aging, and the Commonwealth Council on Aging. This webinar and the microlearning videos that are being unveiled today were produced with funding from the Virginia Geriatric Training and Education Initiative through the Virginia Center on Aging. The Council is grateful for this financial support. On behalf of the Council on Aging, I'd like to thank DARS Aging Services Policy and Communications team for contributing their time and expertise to the development of these videos and this webinar. I'd like to thank the V4A for helping make the webinar possible and for the partnership with the Area Agencies on Aging. I'd also like to thank BES Studios for their tremendous work to produce these videos, these microlearning videos, and bring the Council's vision to life. And lastly, I'd like to thank the Virginia Association for Home Care and Hospice for their partnership in promoting this educational series with their members and the thousands of home care workers across the Commonwealth. The Council got interested in the topic of malnutrition and food insecurity in 2017, when this specific area was added to the Council's duties and scope in the Code of Virginia, following legislation patroned by Senator Favola. During the COVID-19 pandemic, the Council formed an ad hoc committee to look specifically at nutritional needs for older Virginians. As a result of that ad hoc committee, the Council included a stronger focus on nutrition and food insecurity in our legislative priorities, specifically around increased funding for the Seniors Farmers Market Nutrition Program, or Farm Market Fresh, through advocacy around SNAP benefits, outreach, and enrollment efforts to help to better support older adults, and through the pursuit of a grant from the Virginia Center on Aging to increase awareness of nutritional needs and programs. The grant initiative is what brings us here today. We look forward to sharing during these informative videos with you today and through our new home on the Virginia Easy Access website. We hope you will take these videos and share them widely with your professional and personal networks. They are designed to be downloaded and used, and they are available with both English and Spanish subtitles. All we ask is that for those who are participating in today's live webinar is that you complete the survey found via the QR code displayed on your screen. All you need to do is simply hold up your phone's camera to the QR code displayed now and go to the hyperlinked survey and answer a few short questions. The survey is an important facet of our funding from the Virginia Center on Aging for the GTE grant, and we hope you'll take the time to tell us a little bit about yourself and if you found today's webinar and the microlearning videos informative. We'll take a few moments throughout today's webinar to display the QR code and put the link to the survey in the chat in case you didn't catch it just now. So without any further ado, I'm so very pleased to introduce Kelly Wright, DAR's Nutrition Programs Coordinator. Kelly is going to kick off our first video. Take it away, Kelly.
Thank you so much, Carla. Yes, my name is Kelly Wright. I am the Nutrition Programs Coordinator for DAR's Division for Aging. This webinar and the 5 microlearning videos released today are designed to empower you and your programs to be proactive in identifying and providing services and referrals to address malnutrition in your community. So what is malnutrition? It is a medical condition that is diagnosed if 2 or more of the following conditions are present: weight loss, inadequate food intake, reduced body fat, reduced muscle or muscle wasting, reduced hand grip strength, or swelling due to excess fluid retention. About 1 in every 2 older adults is at risk for malnutrition, and local senior nutrition providers may be the first line of defense to recognize the warning signs of malnutrition among the older adults they serve. Malnutrition leads to many complications, including falls and readmission trips to the hospital. The estimated annual cost of disease associated with malnutrition in older adults in the United States is, are you ready for this? $51.3 billion. Malnutrition is related to 2 times longer hospital stays, and sadly, malnutrition-related hospital stays are 3 times more likely to result in death. So again, malnutrition has many warning signs, including unexpected weight loss, loss of appetite, inability to eat or only eat small amounts, feeling weak or tired, and swelling or fluid retention. Validated screening tools can be used by the Aging Network, even those without nutrition training, to determine whether someone may be suffering from malnutrition. Check out the first video in the series to learn more.
Malnutrition has many faces and can often go unnoticed or overlooked. Malnutrition can affect people of all shapes and sizes, income levels, and ages. Older adults are especially vulnerable to malnutrition. Malnutrition is a term describing nutrition imbalance related to either undernutrition or overnutrition, or lacking essential vitamins and minerals. Someone experiencing malnutrition may appear underweight, undernourished, or the opposite, overweight or obese. The lack of nutrition can lead to a host of health issues like chronic disease, muscle loss, and a weakened immune system. For older Virginians, a major contributor to malnutrition is food insecurity, or limited or uncertain access to adequate, nutritious food. In fact, about 1 in 2 older Virginians surveyed about aging issues said they do not have access to affordable, quality food. Nearly 1 in 5 struggled with having enough food, and 1 in 4 either reduced meal sizes or skipped meals altogether. Many common age-related changes can lead to malnutrition, such as memory issues, changes in medications, limited income, lack of transportation, appetite changes, lack of access to grocery stores, or an inability to prepare well-balanced meals. So, what can be done to combat malnutrition and food insecurity? First, use screening tools such as the Nutrition Screen Initiative to assess nutritional risk factors. Understand the warning signs of malnutrition and food insecurity. If you think someone is showing signs of malnutrition, encourage them to consult with their healthcare provider. Finally, intervene. Connect older adults to nutrition counseling, nutritional programs, and other resources. Because your intervention could be vital to that person's life. To learn more about malnutrition and food assistance resources, visit easyaccess.virginia.gov/food or call 211-VIRGINIA. Watch the other videos in this series to learn more about programs available in Virginia. Malnutrition has
So, next topic, what is food insecurity? It's when a person is without reliable access to enough affordable, culturally appropriate, nutritious food. Food insecurity could also mean having limited access to enough nutritious food due to a lack of money. Food insecurity is strongly associated with income, but it is not limited to people living in poverty. Food insecure older adults are more likely to have chronic conditions. For example, food insecure older adults are 233% more likely to experience depression, 90% more likely to experience asthma, and 57% more likely to experience congestive heart failure. Community-based programs, such as those that you work with, can identify and address food insecurity among older adults right in your own neighborhoods and localities. How does food insecurity compare to malnutrition? Food insecurity is an access issue, whereas malnutrition is the result of many factors, including food insecurity. So, how to take action? Malnutrition goes beyond a nutrition issue. It's also a health and safety concern that impacts older adults' ability to achieve and maintain independence in the community. First, screen everyone. Then assess nutritional status. Seek a diagnosis for malnutrition. And finally, intervene with appropriate nutrition interventions. Now, for the definition that everyone attending today's training wants to see accomplished with the people that we serve, food security. Food security is when a person has reliable access to a sufficient quantity of affordable, culturally appropriate, nutritious food. That's where these microlearning videos tie it all together so that we can all have food security. Each of the next 4 videos have a commonality of decreasing malnutrition and increasing food security. Our next video we're going to talk about is congregate home delivered meals. All 25 area agencies on aging in Virginia are required to provide congregate or group meals and home delivered meals for qualifying older adults. These senior nutrition programs help reduce hunger and improve food security. Plus, they provide an opportunity for older adults to engage with other people, which is critical to maintaining health and independence. These interactions also provide an opportunity to screen older adults for other needs before they become a crisis. These programs help more than 2 million older adults continue to live in their community each year. Check out our second video in this series.
Nutrition programs are essential for the well-being of older adults and can reduce hunger and malnutrition. Virginia's 25 area agencies on aging, or AAAs, connect thousands of people to congregate or group meal settings and home-delivered meals every day. Congregate or group meal settings are often hosted at local senior centers, community centers, or faith-based locations. Group meal sites bring older adults together to promote health and well-being by gaining access to nutrition and other disease prevention and health promotion services that delay the onset of adverse health conditions resulting from poor nutritional health or sedentary behavior. Group meal sites also provide opportunities for socialization and recreation that may alleviate isolation and loneliness. For older adults who may not be able to get out or go to a group meal site, AAAs also offer home-delivered meal programs. Home-delivered meals are often the first in-home service that an older adult receives. The program serves as a primary access point for other home and community-based services. These meals can be a lifeline for older adults, just to see a friendly face and have regular check-ins. Both congregate and home-delivered meals are designed to provide a variety of well-balanced menu options. Congregate and home-delivered meals programs are available to adults ages 60 and older. In some localities, transportation is available and can be arranged for those who are interested in attending the community-based congregate meal sites. AAAs place emphasis on serving low-income, minority, rural, and non-English-speaking older adults through these programs. Home-delivered meals may also be available for those in need and their caregivers, spouses, or persons with disabilities. AAAs can help provide nutrition education and individual counseling for those who need personalized guidance on healthy eating or meal planning, especially to help manage chronic conditions like diabetes or hypertension. To learn more about congregate and home-delivered meals, visit easyaccess.virginia.gov/food or call 211-VIRGINIA. Nutrition program.
As you can see, in addition to providing these congregate and home-delivered meals, the AAAs are also required to provide 2 more nutrition services that help defeat malnutrition and increase food security: nutrition counseling and nutrition education. So what's the difference? Nutrition counseling is an individualized medical nutrition therapy and must be provided by a registered dietitian. All AAAs have a registered dietitian for this service. Based on the client's assessment, also known as the Nutrition Screening Initiative, or NSI, the dietitian meets with the participants to support person-centered care by determining individual client nutrition needs, developing and implementing a nutrition care plan, and establishing the client's goals while evaluating the client's outcomes. Nutrition education can be individualized. However, most of these sessions occur in a group setting. Nutrition education should focus on behavior modification, should be relevant and of interest to the audience, should actively involve individuals in determining their personal goals, should include contact with health and nutrition professionals, and meet the Older Americans Act nutrition program's goals, such as defeating malnutrition. Did you know that March is Senior Nutrition Programs Month? The 2024 theme is Connection in Every Bite, which highlights one of the most important aspects of the Senior Nutrition Program: the profound relationship between food and social connection. When local nutrition programs serve and build their communities through meals and fellowship, they provide a powerful reminder that the act of coming together over a meal transcends sustenance. It fosters a sense of belonging, contributes to the health of participants, and creates an opportunity for connection in every bite. Coincidentally, March is also National Nutrition Month. This year's theme is Beyond the Table. Key takeaways within this year's theme are: 1, to establish a healthy eating routine, such as what happens at senior centers with congregate meal programs. 2, practice home food safety. Each home-delivered meal client receives annual education related to food safety. 3, Learn about community resources such as SNAP and local food banks, which you will learn more about in the next video. And 4, eat with the environment in mind, such as the importance of buying foods in season and from local farmers. This links nicely to Video 4's Farmers Market Nutrition programs coming up later in today's presentation. At this time, I'd like to turn the webinar over to my colleague, Madeline.
Thank you, Kelly. Good afternoon. My name is Madeline Burnham, Monitoring Specialist here at DARS. Here to talk with you today about the role of the Supplemental Nutrition Assistance Program, also known as SNAP, and Virginia's Food Bank Network in providing food security and reducing instances of malnutrition in older adults. The SNAP program, formerly known as food stamps, offers eligible individuals and families supplemental funds to be used towards grocery purchases. These funds are delivered monthly onto an electronic debit card or EBT card to be used when paying for groceries. SNAP is accepted as a payment method in grocery stores, convenience stores, farmers markets, and through some online retailers. Eligibility for SNAP is based on income, household size, and assets. It's important to note that these factors can change a lot through older adulthood. For example, changes in income or assets, death of a spouse, or changes in living arrangements. So it's critical that we assist older adults in reapplying for SNAP anytime they experience a life change to find out if their eligibility has changed. Many older adults are unaware that they could be eligible for SNAP. This could be because they've been denied benefits before, or perhaps they have outdated information on SNAP eligibility policies. This is all understandable. As policies change over the years, many older adults remain unaware that they could qualify for assistance. For older adults ages 60 and up, the SNAP application process has been simplified to ask fewer questions and offer a 3-year eligibility period rather than the more frequent renewal process, therefore reducing the burden of maintaining their benefits. This simplified application is called the Elderly Simplified Application Project, or the ESAP. Additionally, there are fewer eligibility requirements for older adults, such as the exemption from the work requirement, making it easier for older adults to qualify for assistance. Additional SNAP information and resources are posted for your reference on the Virginia Easy Access site, which will be discussed with you further along in this webinar. At this time, we'll show video 3 in the microlearning series.
Supplemental Nutrition Assistance Program, SNAP, formerly known as food stamps, provides food benefits to eligible families, including older adults, to supplement grocery purchases. Debit cards are issued to SNAP participants to help with buying food each month and are accepted widely in grocery stores, farmers markets, and online retailers. For example, Amazon, Target, and Walmart. SNAP benefits are determined by a few factors, including income, household size, and other available resources. About 2/3 of SNAP participants are families with children, and the other 1/3 are older adults and people with disabilities. While 78% of eligible people in Virginia receive SNAP benefits, only about 40% of eligible older Virginians do. That's 3 out of 5 eligible older Virginians who are not enrolled. Older adults aged 60 and up in Virginia who want to apply for SNAP benefits can do so by using the shorter Elderly Simplified Application Process, ESAP. This reduces the application burden. The SNAP application can be completed on paper or online using Common Help. Older adults who receive SNAP renew their benefits less frequently. This reduces the burden of the renewal process. For older adults who do not qualify for SNAP or do, but still need additional support, local and regional food banks can also be a good resource for accessing food and groceries. A food bank is a nonprofit food storage and distribution center that local neighbors, retailers, grocery stores, and restaurants can donate to. Food banks distribute purchased and donated food to food pantries around the state to be made available to those in need. Virginia has a robust network of food banks supported by the Federation of Virginia Food Banks. To learn more about applying for SNAP or to find food pantries in your area, visit easyaccess.virginia.gov/food or call 211-VIRGINIA.
As you can see, food banks play a major role in supplying food pantries across Virginia. Food banks also provide supplies to social service agencies, churches, nonprofits, and other community-based organizations to increase access to food and non-food items such as hygiene and pet products. I want to take a moment to highlight a few ways food banks offer support to older adults in Virginia. First, food banks offer a monthly supplemental box of shelf-safe household kitchen staples to eligible older adults through the Commodity Supplemental Food Program, also called the CSFP program. You can find the income eligibility guidelines on your food bank's website. Mobile pantries are also a fantastic resource to those who have barriers to transportation. I encourage you to familiarize yourself with the mobile pantry options offered by your region's food bank. Food banks also collect donations of non-food items from major retailers, such as first aid supplies, hygiene products, and common household cleaning products. Providing these items at your food pantry can also help older adults access the items they may not be able to afford. At this time, we would like to remind everyone participating in the call today to please take a moment to scan the QR code on your screen and take the brief survey about this webinar. This is a good time for you to scan the QR code and at least have it open so that you can complete it through the rest of the webinar. Thank you so much. At this time, I'd like to introduce Matthew Wissikowitz.
Hi, everybody. My name is Matthew Wissikowitz, and thank you, Madeline. Today, I'll be talking about Farm Market Fresh and also Virginia Fresh Match. But first, we're going to get started with our video. We're going to go right into that first.
Eating healthy includes buying fresh fruits and vegetables, which can be expensive and a challenge for older adults on a fixed income. Farm Market Fresh and Virginia Fresh Match are designed to assist low-income individuals with access to fresh produce they may otherwise not be able to afford. The alternative can mean buying lower-priced, processed, or packaged foods that are low in nutrients and high in calories. Virginia's Farm Market Fresh program helps qualified older adults get fresh, locally grown fruits, vegetables, and fresh-cut herbs through their local farmers markets. Adults ages 60 and up are encouraged to apply through their local area agencies on aging, or AAAs. Once enrolled, older adults receive $50 to spend with participating farmers at local farmers markets from June through November. Also, older adults who participate in SNAP can double their dollars or receive a discount on fresh produce through the Virginia Fresh Match program. To learn more about Farm Market Fresh and Virginia Fresh Match, visit easyaccess.virginia.gov/food or call 211-VIRGINIA.
Yeah, so Farm Market Fresh and Virginia Fresh Match, both of these programs serve thousands of Virginians each year. And to discern between, we're going to go into some details that really describe both and lay out how these programs are different from each other and what their goals are. But both of these programs really do aim to achieve long-term community-based food security. And they both do this by functioning in different ways, as the video said. Farm Market Fresh, they serve older adults and WIC families. So as we're talking about older adults, this program does also help out WIC families as well. And it's also really present at farmers markets and roadside stands. So when someone is in the program, they receive a booklet of vouchers to use, and they can take these to participating farmers and farmers markets and also at roadside stands to get local fresh produce and herbs And this really addresses food and nutrition security in these older adults by getting them those local, that local fresh and nutritious produce. And it also really enhances and brings about more awareness of local food and going to a place that they may not have thought was a viable location to get affordable food. And then Virginia Fresh Match, but like I said, both of these programs try to serve and improve community-based food security, but Virginia Fresh Match does it in a different way by serving SNAP recipients. And SNAP recipients aren't going to get a voucher booklet. They're not going to get something always to hand in to a farmer. It is though going to be at participating markets and retailers. At retailers, it's not as available there yet, but there's something that's new that's growing for the program. And the whole goal for Virginia Fresh Match is to really extend SNAP benefits. It does that by doubling what people have available to them when they're at the market. This can happen it can happen automatically at the point of purchase. Some markets provide tokens. It's really different based on what model you kind of have at each different market. Every market's different. But the real goal though is really that food security, community-based food security, having that goal of helping Virginians thrive and have affordable access, and really helping them find that new location where they can actually access fresh fruits and vegetables that they may not have thought of in the past, thinking that farmers markets, they could be expensive. Why would I go there? Not knowing that there's these other programs that are available for them to utilize and get all those fresh fruits and vegetables and herbs. And as the future comes, there are plans to continue expanding these programs until all Virginians are secure and able to thrive, until all Virginians are food secure. So if you want to learn more about these programs, you can visit Virginia Easy Access's website, or you can also go to the program websites at farmmarketfresh.org or virginiafreshmatch.org. When these slides are sent out, you guys can go to the web links. The logos will take you there, or you can also go to Easy Access on your own time. And now I'm going to hand it off to Andy to talk about some more.
Thank you, Matthew. Hello, my name is Andy Pladio. I am the Prevention Programs Coordinator for DARS's Division for Aging Services. Video 5 highlights 2 evidence-based self-management programs that have a nutrition learning component: chronic disease self-management education, which is also known as CDSME, and bingo size. Evidence-based programs, also known as EBPs, offer proven ways to promote health and prevent disease among older adults. EBPs are based on rigorous study of the effects or outcomes of specific interventions or model programs. They demonstrate reliable and consistent positive changes in important health-related and functional measures. Tested model programs are translated into practical, effective, community-based programs, and as a result, the program's content and fidelity will be consistent in all settings. Let's look at video number 5.
Millions of older adults struggle each day to manage chronic conditions such as diabetes, arthritis, or heart disease. In fact, 80% of older adults live with at least one chronic disease, and 68% have at least 2. Chronic disease can severely impact people's quality of life, from losing their ability to do daily activities or to live independently. Traditional medical care for treating chronic disease is expensive and often doesn't treat the complexities of these conditions in a holistic way. One of the best-known evidence-based programs to address this is Chronic Disease Self-Management Education, or CDSME. CDSME refers to community-based programs that provide proven methods to better manage chronic conditions that in many cases can lead to malnutrition in older adults.
There are also specific evidence-based programs recognized by the National Council on Aging with diet and nutrition components to manage conditions such as pain, diabetes, or cancer. For example, the Diabetes Self-Management Program is tailored to address the effects of diabetes and offers people techniques to manage their diet and weight. Another program is Bingo Size, a fun way to promote exercise, nutrition, and falls prevention using the game of bingo. These programs are led by certified leaders, many who are living with chronic disease. Each follows a set curriculum that equip older adults with action planning, problem solving, and decision-making skills. Workshops can be led in person or virtually, and some offer mailed toolkits. Based on a national study, these programs have shown significant, measurable results in the health and quality of life of older adults with chronic disease. To learn more about these chronic disease self-management programs, visit easyaccess.virginia.gov/food or call 211-VIRGINIA.
The following 4 programs fall under the CDSME umbrella. Chronic Disease Self-Management Program, which is CDSMP, Chronic Pain Self-Management Program, which is CPSMP, Diabetes Self-Management Program, DSMP, and Cancer, Thriving and Surviving. The formats of each program are all the same. Small groups that meet in person or virtually for 2.5 hours once a week for 6 weeks. The workshops are hosted by 2 trained leaders who are non-health professionals with a chronic condition themselves. Workshop leaders use techniques to deal with symptoms of chronic conditions such as fatigue, pain, and sleeplessness, to name a few. These programs have all been reviewed by physicians, registered dietitians, and occupational and physical therapists. These programs are also available in Spanish. Each program that falls under the CDSME umbrella tackles healthy eating topics, such as the plate method and how to read food labels, along with other nutrition education. The Diabetes Self-Management Program, DSMP, covers a wider array of healthy eating topics, such as preventing low blood sugar, focusing on fat, making healthy decisions, and dealing with difficult emotions. Next slide, please. Bingo Size has 3 standalone modules that combine the game of bingo with either exercise, fall prevention education, or nutrition education. For each module, up to 20 participants meet in person or virtually for 1 hour, 2 times a week for 10 weeks. The topics consist of exercises, range of motion, balance, muscle strengthening, and endurance exercises, and nutrition education questions. The nutrition module covers in-depth nutrition topics such as macronutrients, such as proteins, carbohydrates, and fat, food resource management, food safety, food labels, choosing healthy options, sodium and added sugars, vitamins, fibers, and supplements and medication. Thank you. Now I will turn the presentation over to Sarah Arnold to show you how to find these videos and resources on Virginia's Easy Access.
Thank you, Andy. Hello, everyone. My name is Sarah Arnold, and I am part of the No Wrong Door team here at DARS. Thank you for taking the time to learn about these wonderful new resources. You can view and share every video you previewed today on Virginia Easy Access, a free and secure website created by No Wrong Door Virginia to make finding person-centered tools, supports, and resources easy. Scan the QR code on your screen or type easyaccess.virginia.gov into your favorite browser. Let's step through how to navigate to the resources from Virginia Easy Access homepage together. First, scroll down to Ways We Can Help and select Food from the group of icons you see in the shape of a sun. You can also navigate using the menu under Focus Areas and click on Food. Once the food page loads, you will find more information about each video topic and links to helpful resources mentioned in each video. On Virginia Easy Access, you can create a profile and save your favorite links to view for later. And through a partnership with Virginia 211, Virginia Easy Access is equipped with a live chat that enables you to talk with a professional 24/7, 365 days a year to find the services and supports that are right for you. These videos are a great resource for training purposes and can also be found on No Wrong Door Virginia's training platform. Scan the QR code on your screen to access the training version of this microlearning series, as well as a growing library of other free person-centered and trauma-informed training resources. No matter how you choose to access these videos, whether on Virginia Easy Access or through No Wrong Door Virginia's training platform, we encourage you to use them in a variety of ways. Embed them on your organization's website. Raise awareness by sharing on social media. Use them during webinars and play during conferences, or use them for a staff lunch and learn. Thank you all again for your interest and support. I'm now going to turn the webinar back to Carla and Jillian for the Q&A portion of the webinar.
So it looks like we have a question. An anonymous attendee is asking, they may have missed it, but how does one apply for the farm market fresh benefit?
Hi, I'll answer that. Just to remind you all, my name is Matthew Wasikowicz, everybody. I am the Farm Market Fresh Coordinator. And so a senior will be able to apply for the benefit by visiting their local AAA. We're also this year going to have an online application that they can access when they go to farmmarketfresh.org. And whenever they fill out that application, the local AAA will get the application automatically, and they'll be able to review and contact that individual for any follow-up steps after that, and to get them their benefit. And if they want to fill out a paper application or over the phone, that's when they go to their local AAA. But the online form should also be on every AAA website as well. Now, the application will open after April 1st. We are just finalizing some programming stuff on it, but it will open up after April 1st this year.
Thank you, Matthew. And I see another question that was accidentally, I'm seeing Kelly message in the chat. Kelly, do you want to go ahead and answer this question as to, can CBOs get access to the screener for malnutrition, or is it another screener that asks the general questions around general STOH needs that include the food insecurity nutrition question?
I'm dropping the screening tool into the chat right now, and that's the NSI that I referred to in the training. I hope this helps. I don't know the rules and regs around if the CBO can use this, but I do know this is the tool that I referred to in the training.
Thank you, Kelly. And again, feel free to put your questions in the Q&A box, which is at the bottom of your screen, just to help us keep track of all inquiries. We do have a few minutes. So if any other attendees have any questions, feel free to, looks like we have one in the chat. Lola Walker is asking, is there any PDF or JPEG version of some of the videos, the video topics from No Wrong Door that can be entered into their Voice of Experience quarterly newsletter for their AAA? I'm not sure who's the best person is to answer that, but
I think Sarah would be.
Sarah, would you mind speaking on that?
Hi, sorry, I was just finding my unmute button. Right now, there's no PDF or JPEG version of the video topics, but that's something we can certainly work on developing. You can access a YouTube link to the videos on Virginia Easy Access and embed those links into your newsletter or use them as you'd like. If you would like to download a version of the videos, we'll be adding those to Virginia Easy Access as well in the coming days.
Thank you, Sarah. Ruth Brown is asking, does the individual need a AAA membership in order to apply for the farm market fresh benefit? I believe that would be for Matthew.
Yeah, I'll answer that again. So no, they don't need to be a member of the AAA. So the requirements to be, or the eligibility requirements for the program, and you all can also find this on the website as well. They have to be age 60 and older. They also have to be a resident of a locality that participates in the program. For seniors, it's statewide. There's no limits on where in the state. It's a fully statewide program. They also can't have a conflict of interest. So for example, you can't live in the same household as someone that's also a farmer for the program, just to eliminate the conflict of interest. And they also have to meet the income requirement, which for farm market fresh, that's going to be 185% FPL or federal poverty level, which we update those requirements every year as we get them from the USDA.
Thank you.
Jillian, I want to take a moment to just say, in case there's any confusion, when we say AAA, what we're referring to are the area agencies on aging across the state of Virginia. When the question came in that sounded like, did you need a membership with AAA? I just wanted to differentiate between the AAA service for, roadside assistance that is commonly confused with what we call AAAs, the area agencies on aging. And so any individual, whether they are receiving other services through their area agency on aging or not, can apply through their area agency on aging for the Farm Market Fresh program. Just wanted to offer that clarification.
Thank you, Madeline. Amanda Serber is asking, are there resources that show clients the benefit of going with fresh versus packaged foods, and how with the resources presented, is it possible to make a switch?
It's a great question. I imagine there are resources, but we would need to do some digging to find that information. Is there a way you could drop your contact information? Or does somebody have that? And I'd be happy to follow up on that.
I can make note of the attendee's name and get that information to you.
Thank you so much.
Another question, by any chance, are there regional breakdowns for food insecurity for seniors? I think they're just looking for if there happens to be any data breakdown.
Hi, Charlotte Arbogast here. I'm not on the presenter list, but I think I can help you. In 2022, the Department for Aging and Rehabilitative Services did a statewide survey of older adults on a variety of topics, and the survey results are available by planning and service area for each AAA. So whether if the AAA serves a county or if the AAA serves a few counties in a region, you can find the data around some of the food components for that service area. That is located on our website, and I'll drop that in the chat. We also have it for the state overall.
Thank you, Charlotte. Another attendee is asking, can multiple persons in the same household all receive farm market fresh benefit?
Yeah, so we have it on our application for up to 2 people, because typically that we see only 2 people in a household. But as long as they're as long as an individual qualifies for the age, income, and they don't have the conflict of interest, anybody that fits those qualifications in a household can receive the benefit. There's no limit on that.
Okay, great. Thank you, Matthew. Another attendee is asking, do you have brochures or printed resources that promote the information discussed in this webinar? We would love to provide these resources to members of our community. And I will note, our speakers may be able to provide more, but I would just like to note that the slide decks will be going out to all attendees in a follow-up email correspondence, along with the link to the webinar recording on the YouTube page. So I know that will be of resource, but I'm not sure if any of the other speakers can speak to any other specific brochures.
Yeah, I'll speak on Farm Market Fresh real quick. Every year we update our handout materials that we provide for all the populations that are involved in the program. Related to our fact sheets and our program promotional materials, we're still finalizing some of that. And so I would recommend when you all that you all reach out to whatever your local AAA is in your community, because I will be sending them all the promotional materials. You all can also reach out to me via email, but I'll have all of the program materials for Farm Market Fresh created by April, a middle to end, because typically we send that out around the middle to end of April, and then some other materials with the voucher booklets that we provided to the local area agencies on aging. That's for Farm Market Fresh. I can't speak on any other programs.
Thank you, Matthew. It looks like we don't have any other questions at this time. If any happen to come in the next minute or so, I'm sure we're happy to answer those, but I will hand it over to Carla.
Thank you, Jillian. So before we do wrap up today's webinar, I wanted to offer two quick final items. First, to help launch this project and spread the word, we'll have postcards available as handouts to distribute. If you would like to receive some postcards to hand out to gerontological professionals or older adults that you may know in your area, please contact Devin Bowers via email. Devin, if you can drop your email in the chat. Second, I'd like to remind everybody one last time about the QR code and the survey link in the chat. Please do take a few moments to complete that brief survey. It is important as we capture information about today's webinar's audience and an evaluation for our programming. If Devin if you can put that link in the chat as well. And lastly, I want to again thank V4A for facilitating this webinar, and also thank the DARS staff and the BES Studios for their support and participation in the video development and today's webinar. Lastly, I would like to thank all of our attendees for your interest and commitment to this extremely important topic. Together, I am confident that we can support older adult nutrition and food security needs. With that, I'll give it back to Jillian.
Thank you very much, Carla. And I really want to reiterate the appreciation for all of our participants on today's call. I think it was an excellent webinar and hopefully very informative for our attendees. And thank you so much to our attendees for joining us this afternoon. As I mentioned, a follow-up email will be going out in the coming days with all the resources from today, including the webinar recording link. And again, keep your eyes peeled. You should all be on our mailing list for the Virginia Governor's Conference on Aging 2025 updates, newsletters, and all things conference related. The dates for our 2025 conference are May 19th and 20th. That's Monday and Tuesday, May 19th and 20th. So we really look forward to seeing hopefully many of you there, and hopefully much interest in joining the volunteer base of putting the conference together. But I just want to thank DARS and all of our attendees for joining us this afternoon. I don't have any other remarks, but feel free to contact me if you have any questions. Thank you, everyone.